In this constantly changing world, 10.6 million individuals were affected by tuberculosis in 2021, representing a 4.5% increase compared to 2020. The number of people living with HIV reached 38.4 million in 2021, a significant rise from 30.8 million in 2010. Malaria cases continue to rise, and the global tally of cases stood at 247 million in 2021, with an increase of 13 million cases from the year 2019. Additionally, the COVID-19 pandemic claimed 6 million lives worldwide. 45% of deaths among children under 5 years old are attributed to undernutrition. 1.62 billion people are suffering from disabilities caused due to non-communicable diseases in 2019, an increase from 43.2% in 1990 to 63.8% of total disabilities in 2019. While the developing nations are still struggling with infectious diseases, NCD burden continue to rise. All of these disturbing numbers are on rise due to the suboptimal functioning of health system. For strengthening health system, World Health Organization has given 6 building blocks, where the leadership and governance building block cuts across all the sectors of healthcare. Leadership training among healthcare workers helps them to work efficiently in finite resource setting. The management of COVID-19 pandemic across the world has shown us that healthcare professionals were not well trained in managing the crisis. Countries with good leadership and governance fared well during the COVID times. The existing trainings are theoretical, not contextual to LMIC, and have a huge cost. Thus, a need for leadership and management training for healthcare workers was established.
Looking at the need of public health management and leadership, I conceptualized this International Public Health Management Development Program way back in 2016. Initially, it was a challenge for me because people were not aware about the importance of leadership in public health. But I took this as a challenge, and then we initiated this International Public Health Management Development Program, which was a huge success, and we could enroll 1,000 plus international delegates from across 85 countries in 6 years.
The program was established with the objective to enable the participants to build capacity of middle and senior managers in designing, implementing, monitoring, and evaluating program and project operations, and to equip participants on appreciating gaps in the current scenarios and envisioning future trends in healthcare management for effective decision-making. Our call for the first course in 2016 received a great response, even though it was self-sponsored by the participants themselves. 100+ nominations were received, and we selected 36 participants from 15 states of India, which included 5 head of department from leading institute AIIMS. One of the alumni of the first course was selected as a director of cultural relations in Peru. He went there and convinced the ambassador of India in Peru to conduct a similar course in Peru, but it had to be conducted in Spanish. And with the call, the program got an international platform in 2017. Consequently, a flagship program of the Ministry of External Affairs and International Technical Economic Cooperation was set up. Therefore, IPHMDP established a second milestone. Officials from the Ministry of External Affairs approached us to involve the senior level or policy level managers, so that middle level managers trained under IPHMDP shall work harmoniously with senior level or policy level managers to fortify the health system. Subsequently, a course in public health policy and management was added to strengthen the senior cadre. Hence, third milestone in the journey of IPHMDP was laid down. These are the few glimpses of IPHMDP courses over the years. Observing the best practices of the international delegates, we realized that an exposure to international practices to strengthen the Indian health system is needed. Following that, we engaged with the National Health Mission of various states and proposed the idea of conducting a course for senior policymakers and program implementers, where they can learn good health system strengthening practices from neighboring countries and replicate them in their jurisdiction and states, where they could learn valuable best practices from neighboring countries that have developed unique and replicable public health approaches. This idea led to the creation of an executive leadership program for NHM officials. Even during COVID-19, when everything stood still, our learning remained uninterrupted as we launched online program under the broader umbrella of IPHMDP. This marked a significant milestone for International Program for Health Management and Leadership Development Program, IPHMDP, as we ventured into the realm of online education for public health. In response to a request from the Ministry of External Affairs, we expanded our online course offerings to include diverse domains of public health management, allowing public health management professionals to enhance their knowledge in areas such as supply chain management, health system strengthening, and quality management. Besides weekly courses, we have launched courses for the duration of 3 months and 6 months. With our program's expanding reach spanning over 85 countries in less than 7 years of inception, the demand for country-specific courses from our alumni continued to grow, leading to the 6th phase of the International Program for Health Management and Leadership Development Program, IPHMDP. These courses are designed to address the need and demand and specific health system-related challenges faced by different countries, fosters the development of marketing abilities, strengthens collaborative network for cross-functional projects, effectively address future challenges within their organization through best practices and innovative strategies. Here are a few testimonials from our alumni.
Good day. My name is Emil Iskandarov. I'm from Baku, Azerbaijan. I'm head of the Division of Emergency Medical Services. IPH MDP's use of gamification is simple, brilliant, and has been a game changer in my career. I can't recommend IPH MDP's gamified courses enough. Thank you very much.
IPH MDP's adult teaching pedagogy is truly exceptional. Their innovative approach blends experiential learning, practical application, and personalized mentorship, creating a transformative educational experience. I highly recommend IPH MDP for anyone seeking to enhance their professional skills and advance their careers in the most engaging and effective way possible.
Good morning, everyone. I just want to say that IPHMDP's use of gamification is simply brilliant and has been game changers in my career. They have transformed the learning process into an exciting adventure, and I really have to say it is incredible how the challenging approach keeps me hooked and motivates even beyond the course and makes complex concepts easier. I can recommend IPHMDP's gamified course enough. Thank you, and I hope to see you soon again.
The target audience for this group are doctor, nurses, middle-level managers, senior policymakers, public health professionals. The impact of our IPHMDP program has expanded to more than 85 countries, resulting in the formation of a global IPHMDP community consisting of over 1,050 participants and a resource faculty alumni group of 100 plus. Additionally, we have successfully trained 620 participants through our online platform.
International Public Health Management Development Program stands out in developing leadership and management skills in senior level managers across the globe. It has a unique pedagogy of learning with fun. We use gamification approach to enhance learning of senior managers. This not only inculcates interest among global audience, but also it is immensely useful for improving the sustainable development goals and increasing universal health coverage across country, which will help in strengthening health system of developing nations across the globe.
As IPHMDP continues to groom visionary leaders and nurtures the potential of aspiring changemakers, we pave the way for a brighter tomorrow. where a new generation of public health leaders will shape the future of global well-being. IPHMDP Building Future Leaders.